The most important thing that we are all concerned with here at Baptist is patients.
Patient safety starts from the office specialist answering the phone all the way up to the doctor making the final decision.
At some point, everyone's going to need health care, and I think of my friends and my family and those that I work with and our current patients that we serve, and that they deserve the best care. And so knowing that I want to be a part of that and meet that goal of providing the best care drives me every day.
Patient safety is our number one priority, right next to patient care and treatment of their disease.
It's about the patient. I think that that's why people come to Baptist Health.
When I'm going to give you a medication, I'm going to scan your ID bracelet again just to continue to have that consistent practice of identifying the correct patient and giving them the correct medication.
You have your nurse and you have your case managers and your physicians or your surgeons, and everyone's going to see the patient and they're talking together about the patient.
As I tell all the new employees, as we tell them when they come in, it's not about us. This is about the patient. So everything you do needs to be directed toward doing the correct thing, the best thing, the safest thing for that patient.
Data can really show us the patterns in the care that we're providing, and it paints that picture for us on where we may need to improve or where we may need to change our process.
We work in every area of the hospital, and we're able to bring those different areas together to see how what they do impacts the other departments and how as a whole they affect the patient experience.
There's a lot of safety touch points, if you will. Everybody has a role in it. It's not just the nurse, it's not just the pharmacist, it is everyone.
First and foremost is hand hygiene. We have a safe culture in our hospital to allow for anybody at any time to stop a person going in the room without washing in and washing out, and remind them in a friendly manner to say, hey, have you washed your hands? Please wash your hands. Number two is we wear personal protective equipment. We always go back to what is the best for our patients.
Including patients and their family members in communication about their care really enhances patient safety. At Baptist Health, we provide shift reports at the bedside to include patients and their families in the conversation, to include them in the discussion and make sure that we know everything that's important to the patient and the family, and that we also share information with them.
It's not only the patient, I get their families as well. So my goal is really just to make sure that they're educated, supported, they're informed, and they make an informed decision about their care.
Before I was a nurse, I didn't understand all the healthcare lingo. I didn't understand what everything meant. There were some big words along the way. There's never an amount of questions that's too much. I'm here to answer every question I possibly can.
Every day, people come through our doors and turn over their most precious gift to us, their lives.
It is not a job. It is not a career. It is not a profession. It is a privilege.
I'm going to make sure that I take excellent care of you and that you're going to feel well informed so that when you go into the OR and you go into surgery, you won't have any doubt in your mind that this is the place that you needed to be and the time you needed to be here, and that we're going to take excellent care of you.